In this module, you will learn the techniques to use when performing a drill and fill repair on Zodiaq quartz surfaces. Use the drill and fill technique to repair the following defects. Surface voids, created when quartz particles have pulled out of the surface or when resin is missing. Off-colored quartz particles that contrast with the basic pattern or color scheme of the top. Other contaminants such as wood, rubber, or metal. Scratches, blotches, or large pigment spots. While small defects may go unnoticed, defects larger than 1/4 inch are often objectionable and, when possible, should be repaired prior to installation. A successful repair will be difficult to find, but will not be invisible. It is imperative that the repair person sets the proper expectations with the owner prior to conducting the repair. The tools required for performing a safe and successful drill and fill are safety glasses to protect your eyes from flying chips and solvent splashes, solvent-resistant gloves made of nitrile rubber to protect skin contact with the solvents, pigments, and filler resins, a variable speed rotary tool such as a Dremel tool or die grinder that operates between 7,000 and 15,000 RPM. Most fixed-speed grinders will operate at 35,000 RPM, which will prematurely wear out bits. Diamond burring bits with an 1/8-inch diameter shank and various cutting head shapes. Ball-tip bits are generally preferred. Low-tack masking tape or painter's tape. Lint-free cloth, white Scotch-Brite, or 4/0 steel wool. Super-penetrating acrylic resin and hardener. Do not substitute acrylic with any other resin, such as polyester. Single-edge razor blades. Pigment tinting kit. Acetone. Toothpicks. Cotton swabs, such as Q-tips. Cleaning rags or shop towels. Mixing sticks, mixing cups, and mixing board. Cover the area around the defect with tape to protect the surface in the event that the bit slips out of the hole during the burring process. Wet the repair area. This will control dust and cool the cutting bit. To make the repair inconspicuous, drill out the defect similar to quartz particles in the area of the repair. It's best to drill straight into the defect to establish the desired depth of 1/16 to 1/8 inch deep. Then work the edges of the hole to form an irregular shape. Slightly undercut the edges of the hole to provide a lip to hold the resin after it hardens. Keep the hole as small as possible. The smaller the hole, the more inconspicuous the repair will be when you are finished. Remove the tape. Dry the area with a shop towel. Put on the nitrile gloves and rinse the hole with acetone to flush out loose particles and remove any water. Blot dry with a shop towel or cotton swab. Caution: do not allow the acetone to come into contact with cabinet surfaces. Be sure the hole is clean, dry, and does not contain any drilling residue. Pour some resin into a cup. Keep some of the uncured resin in the cup in case your first attempt at repair is not satisfactory. Now add the prescribed amount of hardener to the resin as indicated on the resin container. If you use too little hardener, the adhesive will fail to harden. Use too much hardener, the resin will discolor and or bubble. Therefore, use the right amount of hardener or you will have to clean out the hole and repeat the procedure. Using the mixing stick or toothpick, drip the resin into the repair hole and fill it until a small dome of resin is formed above the hole. The excess resin compensates for shrinkage that occurs when the resin hardens. Once the repair hole is filled with resin, make sure there are no voids or air bubbles trapped in the resin. A toothpick is especially effective in removing residual air bubbles. Pour a small puddle of resin onto the tape. Use this puddle to monitor the hardening of the resin. Periodically touch this puddle to determine if it has fully hardened. This normally takes about 45 minutes. A common mistake is to remove the excess resin before it is completely hardened. This will result in a depression when the resin fully hardens. Most repairs can be satisfactorily made using clear resin. However, if you determine that a pigmented resin would look better, Dispense a small drop of liquid pigment onto a piece of cardboard that complements the color or pattern of the Zodiaq top you are repairing. Pour some resin into a cup. Dip a toothpick into the pigment drop and then swirl it around in the resin. Use as little pigment as possible, leaving the resin translucent. This results in a better repair. Using too much pigment will create an opaque repair that will contrast with the top. When adhesive is fully cured, scrape the area with a new razor blade. Keep the blade perpendicular to the surface of the top and apply a quick back and forth motion to scrape away the resin. Caution! Lower angle scraping can gouge or chip the repair area, leaving a slight depression. Be sure to change directions so you don't create a scratch pattern. Change to a new blade when the first one dulls before you are done. Change blades frequently. When you get close to the surface of the top, switch to a new blade again. This is critical. It will help you achieve a smooth, scratch-free repair. Failure to change blades at this crucial point can result in a scratched and dull repair area. Finish removing the excess resin until it is flush with the surrounding surface. Wipe any residual resin from the area using acetone applied to a clean cloth. Clean the entire area with a multi-purpose cleaner. Examine the repair carefully to be sure there are no scratches or chips. If scratches remain, apply acetone to a lint-free cloth and rub the area with more pressure. If repair is insufficient, you may have to start again. You'll know you've done a good job when the repair is inconspicuous. With a little practice, drill and fill can be one of your best tools for repairing many of the problems you may encounter.